Welcome back to Bipolar Talks, the place where we dive deep into the realities of living with bipolar disorder, with empathy, honesty, and a commitment to mental health education. Before we begin, I invite you to settle in mindfully. Take a breath, tune into your body, and let this be a moment of presence for you. And hey, if you find value in what we're doing here, don't forget to like, comment, subscribe, and share this episode with someone who might need it. Your support keeps these conversations going and growing. Today's episode is a big one. We're talking about something that affects millions of people around the world who are navigating bipolar disorder medication. Specifically medications for bipolar. What works and why? Let's get into it. Bipolar disorder isn't just about feeling up and down. It's a complex, often lifelong condition that involves serious shifts in mood, energy, and functioning. And while therapy, routines, and lifestyle changes are vital parts of treatment, medication is often the cornerstone of managing bipolar symptoms effectively. Why? Because bipolar disorder isn't simply caused by negative thinking or stress. It's a neurological and biochemical condition. These shifts in brain chemistry can lead to episodes of mania, hypomania, depression, or mixed states that are hard, if not impossible, to manage with willpower alone. That's why medications are often introduced early in treatment. They help stabilize mood swings, reduce the severity of episodes, and in many cases, prevent them from coming back. But here's the thing. There's no one-size-fits-all approach. What works for one person may not work for another. And that's where this conversation becomes so important. Have you ever wondered why some meds are prescribed and others aren't? Or why one person swears by lithium while another can't tolerate it at all? Let's unpack that. 1. Mood stabilizers. These are the frontline treatments for bipolar disorder, especially bipolar I. Their main job? To prevent the extreme highs of mania and the crashing lows of depression. Lithium. Lithium, the classic, the original, the granddaddy of bipolar meds. It's been used for decades and has a robust record of preventing both manic and depressive episodes. Why it works? Lithium affects sodium transport in the brain and helps regulate neurotransmitters like dopamine and glutamate. It doesn't sedate you, it stabilizes the cycling. Pros. Proven track record. Can reduce suicide risk significantly. Works for both manic and depressive episodes. Con. Narrow therapeutic range. Requires regular blood monitoring. Can affect kidneys or thyroid over time. Some people experience hand tremors, weight gain, or cognitive dulling. Still, for many people, lithium is life-changing. But it's not for everyone, and that's okay. B. Anticonvulsants as mood stabilizers. These were originally developed for epilepsy, but have mood-stabilizing effects in bipolar disorder. Valproate, Depakote, often used in acute mania. Faster onset than lithium for some. Carbamazepine, Tegretol, can work for people who don't respond to lithium. Lamotrigine, Lamictal, especially helpful in bipolar depression and for long-term mood stabilization. Why they work? They regulate excessive neuronal firing and neurotransmitter release, creating a calming effect on brain circuits involved in mood swings. Each has its side effects and benefits, so finding the right fit is about balance and collaboration with your psychiatrist. 2. Antipsychotics. Now don't let the name throw you. These are not just for psychosis. Many second-generation antipsychotics, also called atypical antipsychotics, are FDA approved for bipolar disorder. These include olanzapine Zyprexa, risperidone Risperdal, quetiapine Seroquel, aripiprazole Abilify, lurasidone Latuda. Why they work? They affect dopamine and serotonin pathways that are dysregulated during mania or depression. Pros. Can rapidly reduce mania. Some help with bipolar depression. Useful for mixed episodes. Con. Weight gain. Sedation. Risk of diabetes or cholesterol issues over time. Some people do incredibly well on low doses of antipsychotics as part of a combination strategy. For others, side effects can be a deal breaker. 3. Antidepressants with caution. This is where things get controversial. In bipolar disorder, especially bipolar I, antidepressants can be tricky. If used without a mood stabilizer, they can trigger mania or rapid cycling. That said, in bipolar 2, some clinicians will cautiously use antidepressants like SSRIs or SNRIs, often in combination with mood stabilizers. Why the caution? Because bipolar disorder is not unipolar depression. The brain wiring is different, and pushing serotonin levels up without stabilizing the mood floor can be risky. This is why diagnosis matters. A misdiagnosis of depression when the person actually has bipolar can lead to worsening symptoms. Most people with bipolar disorder don't take just one med. In fact, polypharmacy, using a combination of meds, is common. A psychiatrist might prescribe lithium plus an antipsychotic, lamotrigine plus an antidepressant in bipolar 2, valproate plus quetiapine. Each med targets a different aspect of the illness, mania, depression, sleep, anxiety, and tailoring the combo is part of the art of bipolar treatment. It's not always straightforward. It can take time, trial and error, and a lot of patient self-reporting to find what works. So if you're in that adjustment phase right now, please know this. It's normal. You are not failing. You're experimenting with your psychiatrist to find your unique recipe for balance. Let's talk honestly, because every medication has side effects. And yes, they can be annoying, frustrating, or even scary. Common ones include weight gain, sleepiness or fatigue, cognitive dulling or brain fog, sexual dysfunction, gastrointestinal issues. But many side effects are dose-dependent and temporary. Others can be managed with lifestyle adjustments or by switching to a different med. The key is to communicate openly with your psychiatrist. Don't suffer in silence. There are almost always options, adjusting timing, dosage, or even the drug itself. And remember, untreated bipolar symptoms can be far more damaging than the potential side effects of meds. It's about weighing risk versus reward. Now let's get real for a second. Taking psychiatric medication can bring up all kinds of feelings: shame, resistance, identity questions, the fear of being medicated forever. You're not alone in this. Some people worry that meds will take away their creativity, dull their personality, or make them less themselves. Others fear dependence or stigma. But what if we reframe that? What if taking meds wasn't a weakness, but an act of self-respect? A sign that you're honoring your brain chemistry and doing what's necessary to protect your well-being? You deserve a full life. Meds don't erase you. They often make space for the real you to come through more clearly. Even after finding the right meds, consistency is key. Skipping doses can cause mood destabilization, even if you feel fine. Bipolar disorder is a long game. Stability often comes from routine, not just relief. Here are some tips. Use a pill organizer. Set phone reminders. Pair taking meds with something you already do, like brushing teeth. Keep a mood journal to track changes. Remember, meds don't work if you don't take them consistently, and consistency builds the foundation for freedom. Sometimes, despite our best efforts, a med stops working or never worked to begin with. This happens. When it does, don't panic. It doesn't mean you're untreatable. Your psychiatrist might reassess your diagnosis, add or swap out medications, explore adjunct treatments like ketamine, ECT, or TMS, review lifestyle factors like sleep, substance use, or stress. Treatment is a journey, not a straight line. Keep advocating. Keep asking questions. Keep showing up for yourself. If there's one thing I hope you take from this episode, it's this: there is hope, and there are options. Medication isn't a magic bullet, but it can be a powerful ally in reclaiming your life from bipolar disorder. So be patient with the process. Be honest with your providers. And most of all, be kind to yourself. You're doing hard work, and you're not alone. Thank you for being here, for listening mindfully, and for sharing this space with us on Bipolar Talks. If you found this episode helpful, please like, comment, subscribe, and share it with someone who might need support today. And as always, remember, the content shared in this podcast is for informational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you or someone you know is experiencing depression or any other mental health issues, please consult a licensed mental health professional. Always seek the advice of your physician or qualified mental health provider with any questions you may have regarding your mental health. We'll see you next time. Stay safe, stay grounded, and take care of your brain.